to you all. Okay, good morning and welcome to all of you to this debate that we have today about digitalization of health. We are doing this within the framework of CHESS, which is the health policy program of the European Policy Center. CHESS means the Coalition for Health, Ethics and Society. It's a program that is kindly supported by an educational grant from Johnson & Johnson. My name is Hans Martens, as you can see, and I'm chairman of CHESS and in general working on a number of European health policy issues, and there's quite a lot of them to discuss these days. But we have chosen to focus on digitalization of health today, not because it's a new thing, because it's been around for a while, but rather because the use of digital technologies is moving so fast forward. The technologies themselves are being developed quickly and more solutions are being available, and we need to make the choices about which ones to use. Bigger and bigger parts of the European population is also getting online in various forms and becoming more illiterate, as far as I can see as well. And there's a number of policies being developed, like, for example, the European data space that could maybe give a further push to the use and better use, actually, of digitalization. And I think also the pandemic that we have been through, and maybe soon is over, I hope, has put a focus on digitalization in different ways. First of all, through the increase of telecommunications, you know, more and more people have been contacting their the medical professionals during the digital instruments. But there's also, I think, the question and the pressure now on how to make our health systems more resilient in the period after the pandemic. We'll be hit by a number of consequences of the pandemic, but also feel a lot of pressure coming from poor public finances after the pandemic, and indeed also the demographic changes that really are beginning to push the public budgets in Europe, and indeed also the health systems. So digital transformation has a potential to strengthen health systems resilience and the ability to absorb shocks and so on. I mean, one example is if we, what is being discussed quite a lot, begin to focus more on prevention and also the prevention of disease progression, for example, by having earlier and better and more precise diagnosis, use the big data, use artificial intelligence to sketch out the optimum pathways for the individual and collective patient pathways. So that was just one example. I think we can discuss many more today, but there is one issue which is very important here, which is about if we wanted to reap all the benefits of digitalization, it's crucial that we make this transition also inclusive. And we put that in the headline as well, because that we know that there are parts of the population that already have the skills and the data literacy and so on and can participate, but not all of us. And the question is, what can we do about this? And how can we make it inclusive so that the whole population can be coming in? We might be creating now a new form of inequality in our societies. We normally think about inequality as a question of finance and payment and so on, but this time it could be based more on the ability to participate in the digital healthcare than actually the financial and wealth issues. But we also have a number of other constraints that I'd like to mention in the beginning here, which is the security and safety of data. On one hand, we're seeing serious cyber attacks on public services and of course private ones as well. I don't think we've seen any major attacks on health systems, but that could come and it could have some consequences. And I think there's a lot of fear about what might be happening. The other thing is, what about my data? What about me as a person? What's happening to my data? Why should I share the data? And have that whole discussion about making people confident enough to actually participate in this process, because I think without sharing the data, without having the big data discussion here, we can't really exploit the full potential. So I think it makes sense also for many of these issues to be solved at European level, but we know there's an eternal discussion about what should be done at European level, what should be done at national level. So there's quite a number of proposals here that we can begin to discuss today and maybe make a little wish list about what should be done in general and what should be done at what political level. And we have an excellent panel to discuss this. Actually, the panel has been a little bit smaller this morning because I would mention first Ilse Mariën, who is a senior researcher at the Free University of Brussels. She works on the media and innovation and technology department there. She was going to open our discussions, but unfortunately she has got ill, and she just told her this morning that she won't be able to participate. So that's bad, but we wish her speedy recovery. We are also waiting at the moment for the head of unit for digital health in the DG Santé in the European Commission, Ioana-Maria Gligor. I know she's very busy today, and she said she might not be able to join us from the beginning, but she will join later on, and I think we'll fire the questions on the EU role to her when she comes. I'm also happy to welcome Jan-Philipp Beck, who is CEO of EIT Health, and EIT is the European Institute of Innovation and Technology. And they work in different divisions, but there's a big health division, which Jan-Philipp is leading. We also have the patient organizations here today, Michele Calabrò from the European Patients Forum. And I think you have exactly answers to the questions we might have about e-literacy and how actually empower all the citizens that should participate in this. And finally, we have Sofia Tahoces from Johnson & Johnson. She's Vice President for Strategic Solutions. And I hope that one of the strategic solutions is how we can improve the effect of digital health. So in waiting for the speaker from the Commission, Madame Gligor, I will go down the list here of speakers and welcome Jan-Philipp to start our discussion here today. Your basis is cooperation with authorities, but also with private companies, and I mean your focus is exactly on digitalization of health. So a warm welcome to you, Jan-Philipp, and we look forward to your introduction. Please.
Thank you so much, Hans. Yeah, glad to be here. Looking forward for the discussion with all of you here on the panel, those in the audience, and of course all of those we are still waiting for. It's wonderful. So, yeah, well, let me maybe shoot out just a few considerations from my side to indeed kick off the discussion. Just very briefly, so EIT Health, Hans, as you said, is we call a knowledge and innovation community. So we have 150 member organizations, really, I would say all the ingredients you need for health innovation. There's the industry there, the healthcare providers, payers, but also, of course, the world of research and academia, and lots of startups and entrepreneurs. And we bring this community together in concrete projects that accelerate solutions to market and implementation. We also look at how we can improve the way healthcare is delivered, and it's also more focused on delivering value. And we support, of course, also startups and entrepreneurs in the development of their companies, and we invest a lot also in education and training. So that just very briefly. Now, maybe reflecting on our work, mainly so with innovators, let's say, in the field, maybe I can give a few considerations as to what maybe digital innovations have also had in the response to the pandemic. First of all, I think, of course, we have to recognize, but this is almost a trivial, right? That without digital tech, probably our economy would have totally collapsed during this time. I mean, put differently, we may not also have been, we wouldn't have been able to actually afford and implement the shutdown that we have done, and the loss of lives would have been far greater if we hadn't had the possibility to rely on technology to enable communication, collaboration tools, to actually enable also the continuity of connectivity, business, learning, all of those things. But maybe, of course, focusing specifically on the health sector, I think there's a couple of things where, of course, digital has played a key role. Of course, there is contact tracing. I think we've made some advances there, although admittedly it probably hasn't had the impact that we would have liked to see. But there have been, of course, a huge impact of digital technologies in better monitoring, predicting, but also developing other measures to also support essentially the development of new medicines and also diagnostics. Now, from our community, just a few examples that I think have been directly also really impactful in terms of addressing COVID-19 as such. So I think we have seen quite a lot of digital solutions being built to engage and connect with patients, and also maybe we've had one big project together with a large healthcare provider in France, where we supported the monitoring of patients that had milder symptoms, but due to their risk stratification were actually of risk maybe in terms of developing more severe ones. And in this group, to make sure that we can support them with being in touch during COVID infection with healthcare providers, with physicians, to actually receive support, monitor, and interpret their symptoms. That was extremely valuable to be able to do that through digital means and make sure that people do not have to go to healthcare centers. We've also had an important project that we supported in Barcelona, which relied on analyzing a lot of patient data of patients with severe symptoms, to also understand very early on in the pandemic what measures and what interventions could actually help patients with these severe pathways. So I think we accelerated sort of the learning based on real patient data on what can actually help effectively to treat patients better. So that was one part that we observed, where we saw a lot happening and where digital technologies also helped. Another element, I think, which has been really important, and where we saw, of course, a big acceleration now, is with digital solutions that would also enable us to maintain connection, and to some extent, maybe at least the continuity of care with patients with other chronic conditions whose access to the healthcare system had been severely diminished due to the fact that due to the impact that COVID had on the healthcare system and the stress that it inflicted. Now, I think, and I want to conclude sort of my opening statement so that we can engage in the discussion. I think there is obviously now a huge window of opportunity based on the learnings that we've had from the pandemic, seeing that I think how should I call it? Maybe the appetite, the readiness from the public, but also the patients, as well as also the industry, to accelerate the implementation of digital solutions. So there's a great window of opportunity, I think, that we can use. And I believe there are of course numerous challenges that we can discuss. Since you called out, Hans, specifically the element around leaving no one behind and inclusiveness, maybe just a few pointers from there, which I believe is really important to observe also already in the innovation pathway. So one is, I think, we really need very good standards of also of usability and robustness of applications when we're talking digital solutions that really are for the use of patients, so that we also make sure that people, for example, with disabilities or so, are able to use those. So I think we really need to establish good standards that establish a high level of usability and accessibility. Also, I think of multi-language support. All of these things are, I believe, extremely important. Needless to say, continuing the investment in accessible infrastructure, no doubt that's very important, especially, of course, in developing countries, but also still here in Europe. Of course, also closing the digital divide in general, so supporting people with just the acquisition also of basic and digital skills is a sort of a no-brainer, but we need to find good ways of doing that, and also make investments in this. And then two more things which I believe are also important in the list. I'm sure can be continued with the help of the audience here. But I think one element that we also need to make sure that we consider is that if we build also more and more on artificial intelligence and AI, we need to make sure that we also really avoid, for example, bias in AI. I do think that this is potentially also an issue, bias also in data sets, and that also touches upon inclusion in various ways. So I think avoiding bias is key. And finally, I think, and this is a particularly big topic for Europe, the reimbursement of digital solutions is something, of course, that we need to make sure that it can happen. I think the German legislation here around digital applications is somewhat interesting and also innovative in terms of enabling an early reimbursement of digital applications, provided they can demonstrate, of course, safety, but then to enable actually that you reimburse quickly, also to gather the data to then later really prove the effectiveness and efficacy of such interventions. I think that's good. That can accelerate innovation and can accelerate innovation of those applications that are really needed, because in the end, we need to make sure that we find also pathways to reimbursement for those digital technologies in health that we really need, because that in the end also in the healthcare systems that we have ensures and supports accessibility. So I think we can discuss a lot more around that. I'm looking forward to it. I want to stop here to make sure we can engage in the discussion. Thank you, Hans.
Yeah, thank you very much, Jan-Philipp. That was an excellent introduction. There's a kind of number of issues here to discuss. You were talking about the reimbursement here towards the end, and of course, money is a big driver. But the question is, how are we going to reimburse? Are we going to do it on the cost basis or rather on the value basis, the value that the digital instruments or innovation creates? I mentioned in my introduction this thing about early diagnosis and prevention of diseases and so on. Is that something that we should try to put into the way that we value the test results and so on and so forth? Also, if I may say, one of the things that you talked about this project in Barcelona, but have we actually done enough to know everything about the pandemic? I'm not sure we have. We have tested more than ever, but have we really combine that with other forms of data, and do we know enough now? Jan-Philipp, you are going to.
Yeah, let me start with your first part. So I think indeed making sure that we need a very strong focus on value. Actually, if we don't, I think we will not crack the nut of bringing the providers, but especially also the payers on board. So I think we do see that there is also a challenge in developing enough scale and making sure that innovations can, I think there's still too much smaller testing in maybe small ecosystems. So if we want scalability, which actually is also a key, I think, to some extent to affordability, right? Because if you do bespoke things in hundreds of places, that will drive costs eventually. So I think we need to scale, but in order to scale, we need to bring the payers fully on board, and we can only do that if there is a clear, we need to understand how we can measure then the value and that also digital solutions can bring. And I think that's complex in many cases, but we need to crack that nut and then connect payment to value and outcome. I think it's important.
Yeah, I agree, but we already started the discussion. We can come back to a little bit later on as well. But the question is here, who gets the benefit of the value? The patient, obviously, because they better, more precise treatment, but the society can as well, benefit quite a lot. So we create a lot of societal benefits here as well. Thank you also for underlining the fact that the digital has helped us through this pandemic. It's actually 1.5 years ago now that we had a physical event in chess. So we are all beginning to suffer a little bit from the new disease called Zoominitis, I think. I normally call it, we're too much on Zoom actually these days, but we'll move on. And of course, there's a growth area here for startups in Europe as well. I like to come back to that, Jan-Philipp. Now, I've seen that Ioana-Maria Gligor from the European Commission is on the list here, but I don't know if she's online yet with us. Ioana, are you there? No. No. Let me see. Yes, she is. Yeah, welcome to you. We introduced you this morning here, and I know that you're fairly busy at the moment, probably because you're launching the new role of the European Commission in health, you know, with the big budget and the new programs coming up in a number of areas, which is also close to you, I suppose. So thank you very much for taking your time out to join us here. We started at 10 o'clock. I have introduced you already, but you're head of unit for digital health in DD Santé. And Ioana, we are trying to discuss today not only what to do and how to benefit maximum of digitalization, but also how to include the largest parts of our population in this as large a part as possible. So quite a number of issues here. So we wanted to hear your thoughts on what the Commission's role or what Europe's role could be in this, not as opposed to national roles, but I mean, we need to know that we know that there is going to be a distribution between the powers and so on. So what's your thought on this, and welcome once again.
Thanks a lot. We are quite busy indeed these days, not necessarily with the big plans for the whole future MFF, but rather with the very mundane go live and preparation for tomorrow for the digital COVID certificate. And I hope that for those vaccinated or those with recovery, you got it already, or if you are traveling, you get it. I have mine. I'm very proud of my vaccination certificate, so, and also recovery certificate. So, bon. Speaking about this is probably one of the very concrete examples of the collaboration in terms of in the digital health in Europe, which has been done in a record time and with a lot of involvement of the e-health network and the e-health authorities. And this has shown actually that basically we can somehow go beyond the traditional delineation of the competencies or what it was thought to be the traditional delineation of the competencies in terms of EU and the member states, and together we can do fantastic things. And I'm extremely proud of the way that the e-health network has brought the expertise to do the contact tracing apps and the digital COVID certificate in different formations, but both in the more political formation at the level of the e-health network, but also in the semantic and the technical subgroups, whose role is a little bit less known. They are subgroups of the e-health network, but the level of the expertise is really, really, really impressive. So we really have the best minds in Europe in terms of coding of interoperability coding and IT systems at the national level. So that's something clearly that we want to build upon in the context of the European health data space. And I think that there is a moment and a collaboration that we should take advantage of, and we should put that at best use. Now, what we are planning to do in the context of the European health data space is basically also to build upon the Data Governance Act with the different data spaces, health being one of them, and to come up with a legal proposal on European health data space at the beginning of next year. Also to work on areas like infrastructures for the use of data for the healthcare and also for research and policy making and regulatory purposes. Data quality and capacity building. Capacity building is extremely important, and there is a huge window of opportunity in the current multi-annual financial framework, with important allocations under the Recovery and Resilience Facility, under the European Regional Development Fund, InvestEU, that should be exploited or used, exploited in inverted comma, of course, by the member states in order to digitalize their health systems, to set up electronic health records, to reuse the data for the research and policy making, and to set up also digital services and products, telehealth, mHealth, etc. So what we are working in terms of the legal proposal, basically it's built on 4 pillars. Those pillars are related to the use of data for healthcare, and we are aiming at basically overcoming the current limitations in terms of access to data and portability of data between different healthcare providers, which lead to repeated costs and a lot of loss for the patients and for the society in general. And I'm not really sure that this is what the European as a whole, the Europe as a whole can afford now, especially after this pandemic and after the crisis, and also within in the marge of economic crisis to spend unnecessary amounts just basically for repeating unnecessary tests, which can be basically transferred between healthcare providers and shared at the request of the patients. So this is a little bit what we are aiming to overcome on that area. Also on the digital health services and products, telehealth and mHealth, we are aiming to overcome the current barriers in terms of different legislation, problems related to the interoperability, quality, etc. And just to give a very down-to-earth example, I mean, for instance, another area that we are dealing with in my unit is the rare diseases. And there is a system which is called CPMS, which allows the discussion of the rare disease patients. And the advantage of this is that the case of a patient in rural Romania can be discussed by the best specialists in Europe, in Paris or in Berlin, which in terms of physical appointments would be quite complicated. The system actually allows the discussions between the healthcare professionals, but basically this is what the doctor in Romania, for instance, would need, because the problem with the rare diseases is that the knowledge is very scattered, and the diagnosis time, for instance, takes in average 5 years. So pulling all this expertise, allowing the knowledge to travel, this can be done through the digital world. And this is a little bit what we are aiming at to do in with this support. Now, the second area of work is related to the reuse of health data for research, policy making, and regulatory purposes. We call it secondary use of health data in GDPR language. And here the idea is how to overcome the fragmentation. And we were joking with my colleagues when we started. We had a study at the beginning of this year on GDPR implementation. And if one takes the Article 6 and 9 and the legal basis there multiplied by the number of member states, it's really like a QR code. So good luck for a researcher or for ECDC or EMEA to make sense and to really have access to overcome all this fragmentation and to have access basically to data in order to do the research they need to do, especially cross countries. So there, what we are looking with a lot of interest are the examples basically in Finland, France, Germany, etc., with the data access or permit, as we want to call them, authorities, which have a legal basis, have a trusted governance and a trusted infrastructure for accessing the data, and how can we support that data flow between themselves. And last but not least, the other part is related to the artificial intelligence, and it's also related to the secondary use of health data, and how can we support basically the manufacturers and also the regulators to validate those data. Maybe one more thing that I would like to underline on the primary use of health data, what has been done so far. I was mentioning at the beginning the COVID certificate, that we are also aiming to take this forward and to provide access to the patients to their health data, also taking into account the evolutions, for instance, on the EID. But what we are having already is a network which allows the sharing of patient summary and e-prescriptions between different member states. So a patient from, let's say, Croatia goes to Portugal, goes to the doctor, and the doctor would like to see his or her medication, allergies, etc., in order to give the right treatment to avoid wrong medication. And through some national contact points can request this information and have it in the language of the health professional. Of course, this requires that the data is of good quality, is coded, there is an electronic health record in the country of origin, and can be shared with the country of destination. But this is something that we would like to take further. We have already 7 member states which are exchanging patient summary and e-prescriptions, around 20,000 e-prescriptions dispensed, especially between the neighbors, between Finland and Estonia. The more we see the neighbors, it looks like these exchanges are richer. And we also have, for instance, very concrete examples from countries like Germany and the Netherlands, which would like to share this type of information for very specific cases like stroke patients. So many of the German patients, when they have a stroke, instead of going to a German hospital and going dozens of kilometers, they would prefer to take them to the nearest Dutch hospital for the treatment. And that would also require that the patient summary, the information about the patient, it's transferred with the patient. So that's a little bit what we are aiming. We hope to have 15 member states by the end of this year, and all the member states joining this infrastructure by 2025. And we are also aiming to take this further in the context of allowing the patients to have their data in the language of the country where they travel. So this is a little bit what we are working on a pilot this year, and also on a pilot for the use of data for research and policy making. And in terms of the legal proposal, we are now in the process of the public consultation, and I would really like to ask for the participation in this public consultation. We are also carrying out several studies and the impact assessment, and with a view of the legal proposal at the beginning of next year. So I think these are the main areas of work, in addition to the funding, of course, which takes the form of national investments and also European ones. And I'm available for questions if there are any. Thank you.
There will be, but thank you very much, Jana, for this comprehensive coverage. If you can stay with us, I'm sure there will be some discussions. I'm sort of thinking also, having listened to Jan-Philipp's introductory remarks, that there is a big economic growth area here. I think a new potential for startups as well as we broaden these perspectives. Number one. Number two, Jana, you better get back to work and make certain that this works. The Corona Pass, because tomorrow morning I'm starting my car and driving all the way from Denmark to south of Spain. So I don't want to have any problems on the way. So I'll come back to you if it doesn't work.
I hope it will.
Otherwise, I'll refer them to you. But the other thing is about the data space. I mean, will it actually help us in many ways? I've been living in 3 different countries for the last 25 years, and I know exactly what you're talking about. You know, the doctors having to start all over again, whatever you come to. Even dentists, you know, haven't been able to share x-rays and so on. So it would be really great. But I think also for research, as you were mentioning, because there's a lot of much more richness in the data if we can begin to compare with different situations from different European countries. I mean, our health systems are not that different. I mean, we can certainly, for example, learn a lot about the pandemic if we begin to include the data. So it's for clinical purposes, but also for treatment. But we'll come back to a lot of these questions because we also want to go to the patients forum now. So I'd turn to you, Michele. You always talk about patient empowerment, but we need to empower all kinds of patients here and make it very inclusive. I think that's something we need to discuss also today. Why is it that some parts of the population are more illiterate than others? I mean, I'm very sensitive to this because people say, well, it's all you old people who don't know about digital. That's not true necessarily, but there could be other reasons that could be linked to social status, to education, to I don't know what. Michele, do you have any considerations about this? Over to you.
Thanks, Hans, and well, thanks also to Jan-Philipp and Ioana-Maria because they really helped to set the scene about you know, my intervention. And just linking to what's been said so far, indeed, also from the patient point of view, digital health is clearly recognized as a very positive tool that can help patients and citizens in a tons of different way, and the COVID experience showed that from one point of view, talking about better, more tailored care, better self-management of condition, helping relation and exchange of information with healthcare professionals, which is always deemed as a very important element from the patient community, and of course improve the speed and efficiency of research and innovation, and leads towards better evidence and data-based policy making. So it's clear that there is already quite good positive panorama around digital health, and all the initiatives that were mentioned so far, from the tracing app, the digital pass, which I also downloaded. I also hope it's going to work going to Spain, are definitely going to help us, even beyond healthcare, really traveling around and so on. So the panorama is definitely, getting better, but at the same time, I think something that was already mentioned as let's say, if we want to kind of summarize the issue so far, is a little bit fragmentation in digital health, which is linked to many of the aspects and some of the challenges that are still being experienced by patients, but in general by Europeans. And here we're talking about COVID-19 indeed accelerated further digital health, but we still experienced also, looking at surveys that we had with our members, a scattered and diversified let's say exploitation again of digital health in different countries, both across Europe but also within some member states. And I think this is also linked to what you were mentioning, Hans, about one of the problem in terms of empowerment, understanding and engaging with digital health in all its forms, from I don't know, mobile apps to data sharing, data access, and so on. So, in terms of opening, indeed, digital health, it's a very welcome innovation process in a way from the patient community, but there are still what we can say kind of a multiple speed of exploitation of digital health in Europe for several reasons and for several related challenges. And again, I mean, I don't want to go too deep into some of the challenges, because I probably we're going to discuss them later, and many were already raised, but indeed there is a lack of equal access and an underlying digital divide, which creates some barriers to begin with. Indeed, data sharing across Europe, it's definitely getting better, and we're really looking forward to how it's going to get better even further with the European health data space, but it's really not 100% there, of course. There is a point on also again related to empowerment, to how patients and citizens are really involved in co-designing digital health, both from the policy point of view but also from the innovation point of view, to really make sure that it meets really their needs, their concerns and their expectation, which is also something I think Jan mentioned briefly in his opening intervention. There are also questions that are related to how some, let's say, present but also future technologies might be perceived by patients, but maybe not all of them, and citizens, in terms of eventually limiting human interactions in a way. Of course, telemedicine, for instance, is not as welcome to all specific citizens in the EU. There's a question related to reimbursement as well. Again, they were mentioned. I think Jan was referring to the DIGA framework in Germany, which is definitely one good example of how this could happen. But indeed, I think we're also looking at better harmonization in this area. And then, of course, the terms of access and engagement to the topic of health data. I think it's another very important pillar of what should drive even forward the impact of digital health in Europe, both at primary level, a secondary level. But it's going to be really important that every single individual have an easy, understandable access to the data and control in a way, because in some also having lived in different countries, the way you access, you control, you check if your data is right, and eventually you use it to communicate with your professional, it really varies. So just linking to this general, introduction about, again, some of the challenges and the perspective that were already raised by Ioana-Maria, Jan, and going back to your point on empowerment, I think you identified the right issue there, Hans. It's not cannot be a one size fits all analysis of what patient empowerment is. Well, citizens empowerment in a way is at digital health level, and why it's not working in some areas and why it's working in others. I think one element of this, it's really in terms of analyzing the context. It's really in terms of discussing with other stakeholders, which, for example, EPF is something that does also to several coalition and exchanges that I think are going to also to be presented by some of the colleagues in the panel afterwards. I think it's really just a matter of putting together all the different stakeholders that are involved in the digital health development, from innovation to policy, to make sure that there is a common understanding of what can be digital health going forward, and it should be based on the needs. But at the same time, to do this, to make sure that the digitalization really based on what every single individual needs, again, from citizens to healthcare professionals to health systems and so on, it has to have a right level understanding from different levels. And again, going back to the empowerment side, I think one move that it's essential to be done, again, we've seen a lot of pilots, a lot of initiatives to develop and inform citizens about digital health. EPF indeed is also engaged in some of these activities, such as Data Saves Lives. But I think the next challenge in terms of empowerment is really reaching as much as possible the broader population we can have, because this when we look at data, when we look at getting large data set, unbiased, of good quality data on how we can really exploit telemedicine, on really everything, it's essential to have, in a way, everybody fully on board, not just leaving no one behind. I think it's two parts of the same challenges. It's not just about leaving no one behind, but really trying to create an environment in Europe that is really more ready towards digital health, not only in the countries that are already advanced on that, because of course we have some very advanced examples, Estonia, Finland. We also had practical examples on how they collaborate and how citizens are more ready indeed to work with digital health. We have other examples where there are even differences within the same country. So I think this is really it's really an important challenge. It's really something that we should also look at European level. And it's also something where patient organization and public health organization can really play a fundamental role, because they have, in a way, the pulse of what's the actual situation on the ground in terms of the diverse panorama and the diverse spectrum of who's actually more understanding, on board, and engaging in digital health. So this is a bit my initial address on this.
Thank you very much, Michele. We'll come back to you certainly. I think maybe if the pandemic has been doing anything good, it might be that it has boosted a little bit our use of digital technologies. Broadly speaking, I think Jan-Philipp was also talking about this was actually what brought us to this pandemic. We've been able to communicate for good and for bad, but a lot of it will stay, and probably also in health. But there are a couple of issues still that we need to discuss, I think, in later on today. The question is trust. I mean, we have vaccine skeptics. We also have data skeptics in this area, and whether or not the Europe standing there as creating a data space will help or not help is something that we can discuss. But I'm also beginning to think maybe we should start in school with this, because I mean, there is definitely educational background issues related to this. So maybe it should be a natural part of, as well as all the other things we learn in school, to learn how to deal with digital health. And maybe that would be something for industry to move into as well. Sofia, you are here from Johnson & Johnson today, so very much into not only pharma, but also into medtech, which is encompassing this digital aspect as well. So what are your thoughts here on the basis of what you heard today, Sofia?
No, thank you very much, Hans, and I'm really quite aligned with the previous speakers. So I would like to start today introducing why we need a digital health transformation. So we can move to the next slide, please. So technology is already changing the healthcare ecosystem and increasing possibilities for the patients and their families. And we all know that unlocking the power of health data and AI, as you mentioned before, we can provide broad access to healthcare. We can empower patients to have more control over their health and also increase connectivity between patients, physicians, and hospitals. Ultimately, we are looking to drive towards a more personalized healthcare. We know digital tools in medical technologies also help reduce variability of patient outcomes, and therefore is quite important on delivering health equity. If we now look into what are the major challenges from a technical perspective to unlock, as you said before, the potential of this healthcare data in Europe, Ioana-Maria already mentioned that we have a fragmented interpretation and implementation of the rules for data. And at a national level, we are increased costs and delays in conducting, for example, clinical trials, because since the GDPR interpretation is not harmonized across countries. Second, also is about the lack of interoperability of the systems where data is collected. And we have seen this during the pandemic, where sometimes even mortality data could not be fully compared, as different countries have different ways of collecting data and classifying it. And third, also I mentioned before, is the lack of implementation of standards to ensure that data is of sufficient quality to be shared and generate the right insights. So we all recognize already that we need an harmonized framework at EU level, and therefore really welcome the Commission plan to set up this European health data space that clarify rules on access, sharing, use, and reuse of data for a broader healthcare community. This EHDS obviously be based on federated data network of fair data that will be potential to ensure maximum value and trust. If we now look into the societal side, the key challenge is about ensuring privacy and earning all citizens' trust and active engagement in sharing the data. We believe that this European health data space is an enabler of safe, secure data sharing, which empower also citizens, health authorities, and companies to even level up their ability to share critical insights under the highest ethical and technical standards with agreed code of conduct. In Johnson & Johnson, we support the development of this code of conduct to clarify rules applying to further processing of the health data for primary and secondary purposes. And you mentioned also this morning about digital literacy of citizens, patients, ACPs, and policymakers. Another key issue that needs to be addressed in order to maximize the inclusivity for this digital health transition. And I will come back later on to this one. So if we move to the next slide, please, in Johnson & Johnson, we are proud to be the founding partner of all policies for a healthy Europe. As you know, it's a multi-stakeholder initiative geared towards putting people well-being at the center in all areas of EU policymaking. The coalition brings together a different group of stakeholders such as NGOs, think tanks, trade associations, and companies. And we are happy to see from the Digital Working Group of Healthy Europe also represented today by Michele, who just speak on behalf of the European patients. This digital working group published a policy paper at the end of the last year entitled Empowering Citizens, the Key to a Successful Digital Health Transformation. Obviously, the title says it all. A successful digital health transformation requires empowering citizens to access understand and trust the benefits that new technologies can bring into their lives. You mentioned that digital education efforts need to be in place to raise healthcare professionals and citizens' awareness of the benefits of digital health tools, and also including implication of data sharing and AI. And in this regard, we believe that healthcare workers play a central role, also helping patients to understand and interact with this digital environment. And this also will lead into a better access to healthcare, that you mentioned, by overcoming traditional barriers such as the lack of resources and staffing constraints. This paper focuses in 3 pillars: digital skills, European health data space, and artificial intelligence. And if we pick in one recommendation from each, already mentioned by Ioana-Maria, is that how we can bridge health inequalities through the development of digital tools. So together with the member states, the EU should invest in digital health and disseminate best practices to help citizens, mostly Europeans living in remote areas, disadvantaged socioeconomic groups, and elderly patients. And with this, we will benefit from the digital transformation of health. A successful example of European collaboration of this issue is the European reference networks previously mentioned, through which citizens in rural areas can access to the best experts of rare disease in Europe. Second is about the advanced development of the digital infrastructures and facilities for citizens to access, manage, and share their health data, such as, talked before, the electronic health record systems, while ensuring the portability of the data across different countries. Patients need to have better access to their own data and the option to share this data with healthcare professionals. In this regard, equal access to broadband across Europe is also important to ensure the availability of these services to all citizens. And lastly, as I mentioned before, we need to ensure that the healthcare workforce and patients are equipped with the right skills to maximize the potential of data-driven tools such as AI. So if we move to the next slide, I will also, in this landscape, what it could be the role for the industry supporting all these actions. Industry, as a generator of many of these innovations, should play, obviously, an active role in promoting the digitalization of healthcare. And we know from COVID that shows us the importance of collaboration between industry, lawmakers, stakeholders, and academics. Data and AI have the power to improve, obviously, healthcare outcomes and make progress towards a world without disease. But we need better collaboration, coordination, and harmonization with the health data space. The European health data space will be an essential pillar. The right stakeholders obviously need to be included in the conversation around the EHDS standards designing, and this includes grassroots, clinicians, ACPs, patients, but also industry. Industry, as well as healthcare professional researchers, should also have access to this data, the EHDS data, under fair and equal terms, in order to ensure this data is used and reused as much as possible. The more we use all this data and this data is aggregated, the more value we can get from it and better innovative digital solutions we can design. You mentioned before that COVID-19 also accelerated key transformational trends in digital space. Particularly, we can name solutions around managing patients' pathways, supporting physicians and patients and their interactions throughout their entire journey. And this includes pre, intra, and post-treatment. We have also solutions related to surgical excellence, and also hospital logistics, amongst others, that will be covering all these diseases. We know from studies that patients who play an active role in their treatment do better compared with those that are passive recipients of care. And in Johnson & Johnson, already we are using the power of digital to drive patient empowerment and collaborative decision-making with the clinicians. For example, in 2020, we developed and launched an app called Care for Today Education that provides patients with access to high-quality education for get them better prepared for the treatment. And this is installed in many countries in Europe as far as Australia. Another example is a monitoring tool that enables patients and hospitals to track their patients remotely once they are discharged. In this field, helps hospital also to discharge safely patients and free up a valuable bed space and supporting patients in their recovery. Another project, Patient Pathway Platform, also to design something that was touched before, how we can really measure the value from this digital solution. So this platform provides real-time analytics on the patient treatment journey, patient experience and outcomes to also demonstrate accurately the impact of these digital solutions for patients and healthcare systems. And related to surgical excellence, we have, for example, a digital platform aims to create continuous cycle of quality improvement. So use real insights, analytics to reduce variability in the OR, helping hospitals to deliver consistent high quality of care at the OR. But obviously, for all these examples to succeed and scale even further, as we need a strong and harmonized governance systems, the appropriate infrastructure for data use, reuse, and sharing, and the skills for patient ICPs to take the most of all these new technologies. Industry, we also can provide successful case studies as blueprints of federated data networks. Janssen, which is our farm company, is already collaborating in several projects to increase the access to quality and also usability of real-world data for healthcare decision-making, including through innovative medicine initiatives. Projects such as Harmony and Pioneer define outcome measures and utilize big and deep data sources to improve patient care. And moreover, Janssen is also leading the European Health Data and Evidence Network project, which seeks to harmonize around 100 million electronic health records to create a large scale of a federated network for real-world research in Europe. So I would like really closing that and highlighting that we have just in front of a really great opportunity to transform healthcare for patients and their families, and also for all citizens through digital technologies. And we all have really a shared responsibility to explore possibilities for this digital transition. And looking into fostering an inclusive transition and investing in a future where disease is a thing in the past. And we live with these patients are waiting for us.
Thank you very much, Sofia, and thanks for reminding us on a couple of things. One is that actually increased digitalization could perhaps create more space for everybody at the hospital. I mean, use the resources in a more efficient way. Although we also know that personal contact can be good in many cases. So we'll need to, I think, find the optimal balance here. The other thing is, of course, reminding us that the health professionals needs to embrace this as well. So we're talking so much about the patients and about society, but the health professionals need to get out of their silos as well and think into the optimal use of digital technologies. Now, I was going to ask a question where I actually needed our guest from DD Santé, Madame Gligor, to answer, but she has unfortunately left because she's busy now getting the Corona passport working by tomorrow. I think maybe to ensure that I can have a safe drive. Maybe I'm exaggerating my own role, but I think there's enough to do. She's not around anymore, but the question I wanted to ask first before I open for the audience, because I can see there are coming questions in there, is actually to ask you all, what do you think could be the optimum EU role here? We've had examples now during the pandemic about the Corona pass. It wouldn't work without Europe. I mean, it just doesn't work country by country if they're all different. And I think also on the vaccine strategy, I mean, we've seen an example of how actually we've been able to share the vaccines that are being produced around in the world, and in particular in some European countries, but distributed across Europe. So we have examples here, but are people ready, are member states ready to actually give EU a bigger role in the digitalization of health? Or what kind of role could the Europe play to get the maximum value out of this? Jan-Philipp, is something you have been thinking about or in your work? You need to unmute.
I'm sorry. We now have in EIT Health, we have a little virtual donation box for a good cause. Whenever you start talking with your being muted, you need to drop something there. So no, we've been thinking about this question. I'm of course not inside the member states, so to say, heads and strategies, but I do believe that there is indeed an opportunity with the European health data space and the ambition around it to potentially pull some levers and really maybe be bold enough to actually to enable change. And I think Sofia, you have also touched upon a number of these things. Now, I'm neither a legal nor a technical expert, but what I hear is that we ought to urgently work on also the application of some of the legal norms and their interpretation, and try to make sure that ambiguity is reduced. Thereby also, I think, risks and uncertainty amongst the actors is reduced, and we create a more common, harmonized space. I think this is absolutely essential, and we have some examples that we will also bring forward to the Commission. We are collecting very concrete use cases to exemplify this. And there are things, for example, that I can name in a project in Bavaria, where you have contradictory European, national, and even regional laws that in the end leave us in a space where data, it's interpreted as such that data may only be processed on hospital premises, right? So I think if you run into such things, I think that needs to be tackled, right? And I do believe that it needs to be tackled at European level, my opinion. Now, I also think that in the end, we are talking about IT. So from my humble understanding, that calls for some also standardization, harmonization to ensure this interoperability and quality. I mean, I think it's simple. If I would take the German example, again, forgive me for so many German examples, it's horrible. But in any case, I think we started redeveloping the German healthcare system also post-war, building on strong regions. That was the right thing to do. That was absolutely the right thing to do. That's what we needed. And we need a lot of independence. We needed a strong role for professionals to rebuild the healthcare system. But today, I think for IT, we need more central standardization. And I think we need to be brave to set that. And I think the last element, which is of critical importance, and I think that's especially important for startups, but I think also for the industry, Sofia probably can talk to that. But I think when it comes to health technology assessment and also the pathway to reimbursement, market access assessment, we ought to make sure that we get more basics aligned in Europe. I think for the large countries, they have the capabilities to do this all on their own, but we do need to bring this more together if we actually want to create a market that is sizable. And that links again back to the competitiveness element. If we want to be innovation makers and not only takers from elsewhere in the world, we need to create the market. We need to create the attractiveness for investment. And if we can do that, we can also create the innovations that citizens and patients want, right? That follow also maybe the things that are important, of course, for Europe in terms of, let's say, also a data security and protection concept that puts citizens and patients in the center. Well, if we want solutions that can enable that, well, we need investment to create them here. And that only works with more, we'll say it, I think more harmonization in terms of creating pathway to market. I think there is no other way.
Yeah, and you're talking about the bigger countries. I'm sitting in Denmark with 6 million people, 5 regions, each have their different digital health system, each have their different health portals and so on, and they don't always talk together. I mean, this doesn't make a lot of sense in the way we're talking here. But I know that the minute that the EU is coming up with a model and say this is the one you should take, also for the reimbursement system, for example, it would be just keep your hands off that's a very national domain. Yeah, but let me just say, Jan-Philipp, one thing is of course that you could then maybe try to, and maybe you can help in EIT as well in demonstrating some of the best working examples to emulate.
Maybe we don't need the exact same reimbursement system, but maybe we can start by developing. Well, first of all, there's an element around standardization on interoperability and all of those questions. Yeah. But when it also comes to understanding value and how you basically, how do you prove that that value for digital technologies, maybe we can come to some common understanding on how that's to be done, so that if I'm a startup, I might not immediately get reimbursement in all those countries. Fair enough, we will not get there quickly. But can we get at least, can we get around reassessing and actually regenerating, in many cases, data again and again and again in order to prove my case, so to say, in every single country? I mean, that's something. Can we create some sort of highway, right, that in the pathway to market? I think that would be really good.
Yeah. And we'll see this year, because we have this process in the EU called Health at a Glance, where we're trying to compare now and try to identify what works best and so on. Let's assume that this year there will be quite a lot of digital technologies in there as well, because creating the broad way to forward, Jan-Philipp, is also identifying what works best. You know, what are the best practices, and how can we avoid wasting a lot of money. Michele, have you other thoughts on what the EU should do on this? You will probably not tell us that they should take over the education of the young people in school to teach them about digital literacy, but where's the balance? Where's the EU role in your opinion?
Well, I think we discussed a lot. It feels like the main challenge is digital health at so many levels. If it can be summarized in one word, it seems to be fragmentation in a way, which is still there despite all the efforts, and definitely is going to improve in the coming years. So maybe in response to that, as Jan also said, I think harmonization is what the EU should look at in terms of its role, and I think it is going in that direction. It is going in that direction. We've seen it again with very practical examples with contact tracing, the Green Pass, or EU COVID Pass. I think it changed name in the meantime. And we will see it more with the European Health Data Space. We're seeing with the Data Governance Act, which is creating even an additional layer of potential harmonization. We've seen it with the artificial intelligence regulation, which is another way where the Commission, of course, transversal, but is also going to touch in terms of healthcare. So I think this role is fundamental. Of course, I think you also identify some of the challenges in harmonizing this. On some things, member states will still want to retain as much as possible, their control. We all know, for instance, how long it took to get, the agreement on the health technology assessment dossier, which it's cause of celebration, in these days, but it took a lot. So if we look at something similar in terms of harmonization on digital health, it might take some time, but I think it's essential to start now. And the European Health Data Space, especially looking at this broader scope, it's definitely one point to start, because it touches all the things that in one way or the other should be in a way harmonized also at the European level. Again, primary, secondary use of data, artificial intelligence, you talk about digital health services. I think it touches also on reimbursement and so on. Of course, I think, and you mentioned education and empowerment, that's something that indeed it's not something that can be done in a fully harmonized way, because as we discussed before, there are different levels of understanding, there are different levels of literacy. They are not necessarily due to precise, identification of pockets of the population, because it's such difference. So in that way, I think Europe can play an essential role of coordination instead of full harmonization. Coordination, and at the same time also providing member states with the kind of direction in which to go, but then again working with member states to understand what's the best solution based on the context they are into, because again, we're talking about you mentioned Denmark, of course, but even in Belgium, just living in Brussels, you have 3 different websites where you can find your information about COVID-19. Italy, we have regions, so I think it has to be a very solid, harmonized role at European level to avoid, again, an issue such as the implementation of the GDPR that still creates, some different layers of implementation that are still like slowing down how countries and data can travel around Europe as people can. But at the same time, on some matters, it should also be very much a support and coordination of member states. I think the tools are also there. We are looking into a Youth for Health program that has the potential to provide a lot of inputs on how the European health data space it's going to be delivered. Among other things, of course, we're talking about a lot of money going towards digital. I think it's going to be important, however, to really make sure that from now on we're really trying to move to pilots and examples to really a more solid and overarching approach on digital health to make sure that our health systems will move towards that. And just to close, you mentioned the health at a glance exercise. I think from now on, it would be really important, for instance, if it has, a constant analysis of where we're at in terms of digital transformation of healthcare, because that's not going to be a 1 year, 2 year priority. That's going to be the future anyway, at least part of it. It's not going to replace, traditional care, but it has to be included as an essential tool for healthcare professionals, for patients to better engage with their care, and for health system to be more resilient.
Absolutely. And Sofia, any thoughts in industry generally about who should play the role, or does that matter for you at all? I mean, member states, regions, or Europe, or what? Is that something you are discussing with yourselves as well?
Yes, and it's most of has been already said, and is that also Ioana-Maria was sharing that we have now, as Jan-Philipp was mentioned, a very fragmented data across countries, and this is also causing problems different access from different countries, and different in the interpretation in the case, for example, of the GDPR. And I think that also, to add something that it was not mentioned, is I think that it's important that when we talk about health data, it's quite important the sensitivity that this means also for patients and citizens. And I think that when we will have in place the HDS, will be helping also to have enough fragmented data, and also more trust and more accessibility for the patients and citizens, in order really to share that data. And looking, as we said, that this data is available and can be provided from them to different healthcare providers. As I said before, I think when shaping these standards on the European health data space, we need also to do from an inclusive design. So it will be healthcare, it will be patients, also industry and researchers should be included in the design of these standards, and also to have access and the usage of the data that is provided there. So this will be some adding what previously was said here.
Hans, you are muted.
Okay, Jan-Philipp, how much do I need to put in the box there?
Yes, you can
a couple
put
of million.
Our box. We'll do something good with it.
Okay. So I just had a question coming in from the audience here. Did I interrupt you? Did you have something?
Please.
No, okay. Mr. Pascal Leroy asked the question, one of the EU societal challenges is marrying the digital agenda with the circular economy agenda. Has any of the panelists considered the circular economy dimension? I suppose this is well, maybe before I'm telling you what I think about it, maybe I should ask you, what is your reaction to this? And Philip, you look like you have something to say.
No, I looked like I was scared of the question.
Okay.
I think it's no, Hans, please start. You said you wanted to. So
No. I was just saying circular economy can be defined in different ways, but I suppose this is a question of having a, let's say, a ecological aspect or environmental aspect on the digitalization as well. So.
And I think, I mean, I know the colleagues that are working, for example, in EIT raw materials and climate. So we have different kicks that are addressing those challenges. Of course, there is, I think, the question also around how do we make sure that we address those challenges well, and also monitor the footprint of digitalization is important. Also seeing how we can enable that. I believe that there is a strong connection, for example, now, of course, also between climate climate protection and addressing impacts of climate change and health. But I mean, this is a huge and enormous area. I leave it also to others to comment.
There are many aspects of it, clearly. Data requires quite a lot of energy, and energy needs to be produced, and that can be done in many different ways. But I also think that, for example, using technology the way we do today is saving quite a lot of travel, because we have people coming from different parts of the world together. But I think also what was mentioned earlier about the doctor in Romania, for example, pulling in the expertise without people traveling across Europe, best expertise in Europe, and sharing this when you have rare diseases is a very good example of a climate-friendly utilization of the digital technologies. But Michele, any thought from your side? On mute. Yeah.
Nothing really to add to what you said. Indeed, digital can help reduce some of the travels for patients, for the experts, as you mentioned. Indeed, I'm not an expert in the field, but it does seem that the more data we consume, we look at, there is an ecological impact out of that. But indeed, it's really not something that we are looking into, unfortunately.
Is industry doing that, Sofia? And then I'll come to you, Jan-Philipp.
Yeah, we have different initiatives in the space of sustainability, but when we link this, the question is related to the digital healthcare. I think that, as you mentioned, if we look in a world that we have from technology, we are looking in order to have less patients and more citizens that we can, that not need to be treated, that they have a care of the health before to get ill. I think that is also reduced in terms of traveling and in terms of many resources that we need to do these days in order to treat patients. So for a world with no diseases that is more in a preventive space for diseases, I think that is also quite related to a more sustainable world as well.
Jan-Philipp, you had a comment more?
I wanted to come back. Not precisely to this piece, but just on the question of the roles again, Hans, right, and what the national level should do in the European level. And I sometimes wonder, and that's maybe there are also reflections in the audience on this, whether it could be good for us from the health sector perspective sometimes to also look a little bit at other sectors. And of course, we shouldn't jump too quickly. There are a lot of particularities, but I sometimes feel intrigued by considering, for example, also the financial sector. Right? I mean, an area where security is important, we handle a lot of very sensitive data, cybersecurity is an issue, governmental regulation tends to be high. But now I think here, if we look at also how that has evolved over time, first of all, also there has been a significant change in terms of how now the customers are interacting with banks. That has changed dramatically over time. And then we have issues, of course, around accessibility and access and all of those questions. But I think it's something that we can look at. But most importantly, maybe for our discussion here, to my understanding, we have seen quite a lot of very regulation, but also, of course, connectivity being established to make sure that financial transactions can work across borders in Europe, safe, to some extent also monitored and controlled, also to address crime and all of those areas. So if we can do that, right, thus, why shouldn't we be able, in principle, to do it also with other sensitive data, right? So I think sometimes it might also be useful to challenge ourselves, but also maybe to challenge sometimes the policy makers with such comparisons, being aware of the limitations, but I think one can do that. Another example is the tax revenue service, where digitalization is often advancing at speed, obviously because there's also a great need to make sure that that works well. And I think that's also something that the government very well understands. But also here we are dealing with highly complex, extremely sensitive data. So again, if we cannot do it there, why shouldn't we be able to do it in health? So I mean, it might sound now that I'm being overly simplistic. We're also talking about driving a little bit the policy debate, and sometimes this might be useful to also advance and look beyond one's own sector.
Yeah, you're right. And I can't even remember when I was last time physically in a bank, because you don't need to go there very much anymore. And the way the banks are organized is demonstrating that as well. Luckily, I haven't been in a tax office either for a very long time, but they know how to find me anyway. But in any case, the comparisons are good. But if your tax data and your financial data are very sensitive, why is it that people are more nervous about their health data, apparently? Is it because we need a debate about this? We need to ensure people about the safety and so on and so forth? Because I have a feeling, and I know it varies around Europe, but I think there is a deep resistance against, you'd rather donate your kidneys than donate your data, it seems to me many times. But I don't know if we have any answer to that.
Michele might be a good expert on this. I believe that I think, of course, that we need to do much more work in providing clarity on what we do with the data and who will do what with what purposes and who is allowed to do what. And since we, of course, are all still also in exploring that and trying to understand that, it's maybe sometimes also hard to formulate all of those answers. But I think that's something that we ought to do. And I think we should maybe also need to turn a little bit the debate around, also focus on, of course, the opportunities, also the opportunities and technologies available today to protect data. I mean, this is quickly advancing, whilst at the same time also saying what opportunities for improving health and improving systems comes with that. And maybe also even moving as far as saying at some point there might be, there might also at some point be, considerations to be made that there is this sort of, I don't want to be misunderstood in terms of using force here, but I think there is maybe also an ethical prerogative maybe emerging at some point to say, isn't there also an obligation that we organize this sharing more in order to also enable and derive the benefits we can get? So don't we have an obligation also to move forward, to advance in this field and take people along?
And maybe also talk a little bit more about the good things that digital technologies can do. I mean, because we talk a lot about what other things can do for society and for the individual, and here's quite a number of things that hasn't really been put on the agenda yet, but maybe should be as well. Sofia, you're unmuted. Does that mean you have a comment?
No. I think that we were started. This digital journey just before COVID-19, but what we have with COVID-19 related to health is that we need to really go faster. And as Jan-Philipp was mentioning, we have many other spaces that it looks like they are more advanced in the treatment of data, or at least to get the trust from citizens for them to handle their data. The great opportunity is that there is many things to do, but I'm pretty sure that we are going to get there, because society now is looking into how they can really have as well the same health digitalization that they have with other fields. I'm pretty sure that the European health data space is going to make a change. As I mentioned before, we during the pandemic, we see that even though at sometimes we were not comparing mortality data or mortality rate across countries. And this is also translated into me as a citizen, how I can believe that this could be treating my health data if it is not comparable. So I think that it's a room to improve, but a really great opportunity. Because other fields get there already, I think that in health we will do the same. And it will be also in terms of accessibility for health is really key in order to really moving into to have more patients treated.
I think we need some good stories as well. We need to tell the stories about how digital health can actually help, both on the clinical side, but also on the research side, actually, to deal with a number of the issues. Jan?
And I think if you're made, I think you will also need to activate the right storytellers. And I think if we see who are the people who are trusted most in the healthcare system in relationship to patients, if I'm not mistaken, I think those are still often the doctors in primary care that people have relationships to. It's not the industry, probably not EIT Health, so not even known, certainly not the European Union. So I think we need to get them on board. They might be the ones that will need to sit down with the patient and say, look, this is the app that you should be using. This will really help. This is how this can also improve our relationship. I think if we don't achieve that, we will probably never bridge that last mile, really. And then we can use a lot of these technologies sort of in the back end, but if we actually want to use them for direct patient use and interaction where there's a lot of potential benefit, I think we need to get the healthcare professionals really on board and help them also to understand what is good, what's not good. We need to simplify the space for them too, and structure this well.
And probably even healthcare professionals in the very first instance. I mean, primary healthcare doctors as well. But Michele, there is another kind of people that are trusted between the more than anybody else. I think it's the patient organization. So you have a responsibility as well.
Well, yeah, I mean, especially just coming back to what was said, I totally agree on the point of healthcare professionals. I mean, the more and more we discuss with our members, the more on digital health, it seems that there is this kind of triangle essential with digital health, healthcare professionals and patient that needs to indeed form, a trusted and clear kind of collaboration. And it's needed. And of course, healthcare professionals are trained, skilled, and have also the right resources, even in terms of time, to have a good dialogue with patient, to indeed do everything that was mentioned before, explain which app they would use, eventual consult on an app that maybe it's actually not the right one for them, and so on. In terms of health data, I think the important point it's trust, clarity, but also communication. And I think we saw in terms of communication, at least in some countries, and I'm talking about personal experience, a bit of unclarity on how authorities, but also the experts themselves, communicated about the results based on the data that was gathered during COVID-19. We actually had a recent workshop within one of our projects, the Project Periscope, where we discussed with health authorities and policymakers the key challenges in digitalization of health, among other things, in the response to COVID-19. And we did notice that although even in some countries where there was a lot of data and a lot of extreme acceleration of how data was transferred between hospitals to policymakers to make sure that there was a clear understanding of how many beds were available and so on. But then again, we did have a level of communication back to citizens that sometimes was creating more confusion than actually clarifying. And this, of course, if you don't really understand, or if you get too many information that are not clear, even this does not help on creating trust on data. That's I think sure. Then it comes together with health data literacy and engagement with healthcare professional alike. So I think they are all parts of creating that environment where everybody is really not just accepting passively digital health, but really engaging in a positive way to ensure that ultimately digital health can actually be exploited for everything that we discussed. In terms of closing on patient organization, I mean, we are, of course, very much open at European level to be, partner with the institution to help shaping, the right policy frameworks based on the needs of our community. That's what we're doing. We're going to respond to, the European data space in several manners. We have already engaged with the Commission and collaborated with them. we need, of course, to then have the right resources to build capacity also at national level with our members, because they are the one that are in daily contact with the patient community, and they can, of course, be the one that can convey many of the information that are needed to tackle the challenges that we discussed today. Why they don't trust, why they don't have like enhanced level of trust in data, why are they not yet using all the digital health solutions, why are they not engaging enough with telemedicine, is it a problem of not understanding, is it a problem of lack of clarity, is it a problem of having too many platforms and you don't know which one to use. I think that role of patient organization, both in terms of, at least talking about the European one, being partners with other stakeholders and with the European Union to shape different better frameworks, starting with the European health data space, but at the same time build capacity for local and national organization to have a better connection with the community, to make sure that the challenges are addressed based on what's actually the situation on the ground. I think professional organization is the double role that we might have.
I'm pushing this because it seems to be a big barrier, to actually get people on board. And I've seen too many discussions where experts are convincing experts, and we need to reach out beyond that group to talk to people. So I think we've had some good proposals here. I'm very cautious about the time because we're actually running out of time. I don't think there are any more questions up there, but I'd like to say a few words by the end. So Sofia, do you have something for 10 seconds?
Remark. As I said, I think that we have really a great opportunity to transform health through digital technologies, but it's a shared responsibility where everybody should be collaborating and coordinated. I think that it's a future where patients will have more opportunities, and we will be also having access from patients that today they are not have access to the right healthcare system.
Right. Okay, but it's been a very rich discussion, I think, today. We haven't got precise answers to everything, but we have raised quite a number of issues, and I think also we have agreed on, how important it is to eliminate the barriers for the further development, because I also think that this whole area is a big growth area for Europe. I think Jan-Philipp was mentioning the potential for SMEs and entrepreneurship in this area, and I think we are depending very much on the rest of the world. We need a push that actually a bigger European market could get, also as an instrument to get out of the pandemic, because we need some new stuff here to create jobs and so on and so forth. So it's a good growth area here, and I think there is quite a lot win-win situations in this, because I think we can improve value for patients, for the health system as such, but certainly also for the societal economy, for the whole fabric of our societies, if we can improve the resilience of the health systems by the help of digital transformation. So it's good for everybody, it seems. We just need to make it happen, and a lot of issues should be put into thinking about how we can actually create the trust. Creating a European data space will help, but it won't solve all the problems, because that is not what people are looking for when they look for trust. I think the communication directly from people they trust, the healthcare organizations, the healthcare professionals, is a better way to do. And maybe we should even begin to think about, teaching these issues early in the school. So making it happen is important. It is important, as been mentioned today, I think, introduced by Jan-Philipp, the question of reimbursement models. We'll need to identify how they can work best. But the thing is, it can't be cost-based. It has to be in some way or another based on the value, that we need to find ways to estimate how much the value is actually created across the board, from the patients all the way to the societal economy. So there's quite a lot to be told here. We need the good stories to be put out, and I think you have done a great job in helping us doing this today. So I'd like to talk to thank you very much, all of you, in particular also Ioana-Maria Gligor, who had to leave us here, but then Jan-Philipp Beck, Michele Calabrò, Sofia Salido, Tahoces, No, Tahoces, yeah, it was. Thank you very much for spending time with us this morning, and thank you for your very good ideas. I hope we can continue this debate to the benefit of European citizens and to get us out of the aftermath of the pandemic. So thank you very much. See you soon again, all.
Thank you.
Bye.
Thank you.
Thanks,
Thank you.
everyone. It was a pleasure.
Thank you.